You're in the trauma bay, you're in the ICU, someone is no longer able to maintain their airway. For whatever reason, you have to intubate them. How do you induce anesthesia in these patients so that you can secure an airway? Let's talk about that. I'm Zachary Mead, a PGY4 anesthesiology resident. I induce people literally every day. I do controlled and uncontrolled airways. There's three main drugs that we use frequently: Propofol, etomidate, and ketamine. These are the three main choices you have. Each one has its own uses. I encourage you to understand when and why you should use each one. And also, it's kind of like a cocktail party. You can mix and match if you want to as well. Focus on the advantages and disadvantages. Big advantage: it's very effective. It's an anticonvulsant. It can reduce ICP if you need it to. Disadvantages: it's the one that causes the most hypotension or low blood pressure. So if that's a concern, might not be the best choice for you. Ketamine: it's really good at maintaining your hemodynamics. However, that's adrenal dependent because it is a direct myocardial depressant. Additionally, not the best choice if you have a patient who's having a massive NSTEMI because it can increase myocardial oxygen demand. So probably don't use it in that instance. If you're going to use it, maybe mix and match: a little propofol, a little ketamine. Etomidate: really good at keeping your hemodynamics stable. Not so good for your adrenal glands. It has up to an 80% adrenal insufficiency, meaning that if you give a one-time dose in a critically ill patient, about 80% of those patients for the first 24 hours might need additional supplemental steroids, which is okay though. You can do that. After about 2 to 3 days though, your adrenal glands start to work again, so it could be totally fine. Here's a quick reference table that you can keep, screenshot, and look back at it for later. There's a lot of other nuances in there, right? For example, ketamine, it might increase ICP, though kind of mixed data, might not. If you have a head trauma patient and there's a medication that might increase ICP, I don't know, maybe just skip it and use one of the other two that we talked about.